We were going to bring you a system update tomorrow, but we're getting so many questions today, we felt like we needed to bump it up. So we appreciate everyone joining us on such short notice. So we have Dr. Kenzie Graves with us today. We have Aaron Klaus, and we have Dr. Jose Rodriguez. So we're going to start with Aaron, who will give us her current projections on COVID numbers at our healthcare system. We'll then talk to Dr. Graves, who will give us an update on what's going on in our system. We'll open it up for questions, and we do have Dr. Rodriguez available to answer questions in Spanish. So with that, I'm going to turn it over to you, Aaron.
Thanks, Kathy. Good afternoon. So a number of you have seen these charts before, and we're looking at a Utah view right now. So what's going on in the state of Utah? So this chart is showing us the positivity rate. So out of 100 tests completed, how many are coming back positive? Using both methods, the people over people method and the testing over testing method. And you can see, compared to this time last year, we are higher. So 50% higher on the one and 19% higher than the same time last year. So this is, remember, this is the first signal of transmission in our community. And this is heading definitely in the wrong direction. And go to the next slide. This is a newer chart that I'm putting together, seeing if there's a seasonality to COVID-19. Again, at the Utah level, the blue line is what we experienced and all lived through last year, as this is just looking at cases per day. The orange line is how we're tracking this year. So we're looking close to where we were last year and right before the big bump that started in the fall. To move on. Here we are looking at the gray bars in the background, showing the positive cases, positive test results in different methods, both the antigen and the PCR testing. And then the lines that are overlaid on top are hospitalizations. So you can see as cases go up, we see hospitalizations going up. The orange are indicating the total number of people currently hospitalized in Utah. That's 45% higher right now than it was the same time last year. The red line is ICU beds currently being used for COVID patients, and we're looking at 23% higher than we were last time, the same time last year. Here we are jumping to vaccinations. We'd like to see this green bar get bigger and bigger. This is the percent of each age group that are considered fully vaccinated. Either they have one of the Johnson & Johnson shots or two of either the Pfizer or Moderna shots. The yellow in the middle, they're halfway in, they have one shot completed. And this red section on the top is the percent of each age group that has currently no vaccinations. It's not surprising that the younger age groups have larger red bars. They've had less time than the older groups to get their vaccinations in. But what I am seeing over time is that the older ages, they really did a very fast uptake in the vaccination. As soon as they were available, they got them, and they really got up to 70, 80+% of the age group were vaccinated. The younger age groups haven't had as much time, but really a slower uptake in getting their vaccinations completed. Can move on to the next. This is another new chart that I'm putting together and looking at a case rate. So out of 100,000 people, how many are we expected to see with a new case each day? And then breaking it out from unvaccinated to vaccinated. And you can see that the unvaccinated population at the top have a much higher rate, 4.5 times higher likelihood or rate to have a new COVID case than the vaccinated group. What I think is interesting here is the blue line is increasing as well. So we know these vaccinations are not 100%. There is going to be some breakthrough cases for the vaccinated individuals. And as we've learned, is the more there's just spread in our community, the more likely that there'll be a breakthrough case. So we can see that blue line is actually coming up as well. And that's it.
Thanks, Aaron. Dr. Graves?
Hey, good afternoon. I'm Kenzie Graves. I'm the Associate Chief Medical Officer for Inpatient Care at the U. I'm also a palliative care physician and a hospital medicine physician. So I'm here to talk a little bit about the status of our hospital at this moment in time. So UHealth is extremely busy. We have double to triple the number of COVID cases in our hospital that we have had in the past 1 to 3 weeks, depending on what time point you look at. We have the same amount of COVID patients in our hospital that we had back in July of 2020. As a state though, Aaron just pointed it out that there are more. We at the U have started to postpone some of our surgical cases. The reason for that is because we need to be able to create capacity to take care of those that are critically ill. So about half of my medical intensive care unit beds are full of patients that have COVID-19. The majority of those are unvaccinated. And so to sum that up, we are taking actions through our health system to create capacity because COVID is surging again. So I'll repeat something that I said a few weeks ago, and that is that the pandemic is not over. The more amount of COVID in our community, the more COVID there will be in our community. It's a transmissible illness. The Delta variant is more than twice as transmissible as the native virus that we were dealing with a year ago. So what we need as healthcare workers, there are fewer of us than there were a year ago. Most of our health systems have a lot of open positions. We need people to get the vaccine, to stay safe, and use the public health measures we need to do to restrict transmission. Because COVID is still out there, it's still hospitalizing people, especially those that are not vaccinated.
Okay, thanks, Dr. Graves. And Dr. Rodriguez, do you want to make some brief comments in Spanish, and then we'll start taking questions if anyone with questions wants to start putting those in the chat. Dr. Rodriguez.
Yes. Ahora, gracias por estar aquí y realmente lamento que estamos aquí para compartir realmente lo que yo veo como malísima noticia. Como hemos visto, los casos de COVID están subiendo en una manera que realmente es sorprendente. Estamos en los niveles ahora que estábamos en el año pasado en la misma fecha. La diferencia es, uno, que tenemos la vacuna, y dos, que la gran mayoría de las personas que se están enfermando son personas que no han sido vacunadas. Encima de todo eso, hemos visto que estamos en una posición donde tenemos que cancelar cirugías o postergar cirugías porque necesitamos los recursos del sistema de salud para cuidar a personas que están infectadas con COVID-19. El gran problema que debemos de reconocer es que COVID sigue siendo un problema en la población latina. La pandemia no se ha acabado y los mismos problemas del año pasado, que teníamos una tasa de infección más alta que las otras poblaciones, sigue siendo la verdad y la realidad hoy. Así que somos 14% del estado. Es hora de tomar acción individual y acción estatal para realmente cambiar el futuro.
Okay, thanks, Dr. Rodriguez. So we have a lot of questions. First question, Dr. Graves, what are your thoughts about should Utahns return to wearing masks and taking other precautions against the Delta variant?
Yeah, that's a great question. And so I can talk about what I've seen in the trends and what I know as a medical professional. So we are seeing an increasing trend that is really quickly rising. And so, as I said, COVID in the community is more COVID in the community. And so I do think there are some public health measures that we can take to limit transmission. The most important, though, I think, is getting the vaccine if you have not. The vaccine is very safe. Millions of people have received it, and it will, for the most part, protect against serious illness, hospitalization. Yes, the virus is out there. And so I think if you are unvaccinated, this is a really great time to be wearing a mask in public and staying socially distant from others. We know that indoor transmission of COVID-19 is higher than outdoor transmission. And so we need people to get vaccinated, and we need people to use precautions to prevent transmission of COVID-19. This summer is different than last summer in that we have half of our state vaccinated against COVID-19. However, there are people living life like the pandemic is over. So transmission may be higher now, despite that we have lots of vaccines. So more vaccines, take care of yourselves and others. We need to prevent more transmission.
Okay, thanks, Dr. Graves. And can you also give us an estimate of the percentage of elective surgeries that are being postponed? The keyword there, postponed, not canceled.
Right.
And do you foresee these procedures being put off indefinitely if case counts, hospitalizations continue to rise?
Yeah. So one thing to recognize is the major health systems in Utah right now have hundreds of open positions. That's a little bit different than where we were a year ago. The reason I bring that up is because what we were able to do last fall to stretch our capacity in open surge ICUs and take care of extra patients, we do not have that option anymore. So to create capacity to care for critically ill patients, we have to use other methods, and that is what postponing cases is. So I want to be clear, no one at the University of Utah wants to postpone a case. We want to be there for our patients. We want to take the best care of people that we can. But if there is not a bed for you and a doctor and a nurse, we cannot do a surgery that is safely postponed. And so that is what's happening. And so essentially we have postponed a small percentage of our cases that can be safely delayed to be rescheduled when this surge starts to drop. Now, we know that hospitalizations follow positive tests by a number of days. So personally, I'm very alarmed by our case count today, and I hope this does not become our 7-day average. But we need to manage this virus in our community so that we can safely take care of patients who need us for other things.
Okay, thank you. A question from Haley Hendricks. A preliminary study suggests the Johnson & Johnson vaccine may not be as effective against the Delta variant compared to the other two shots. More than 132,000 Utahns have received the J&J shot. For greater protection, could these individuals need to receive another of the vaccines?
Is that to me?
Yes.
Yeah, okay. So I personally worry about making this more complex than it needs to be. So bottom line, a vaccine is better than no vaccine, period. So if you can get a J&J, that's better than no vaccine, even if there is less efficacy against the Delta variant. A vaccine is better than no vaccine. There are ongoing studies about what we call kind of the mix and match strategy, where you get one Pfizer and one Moderna, but that is not what we are doing widely at this point. And so the most important thing is getting a vaccine, as it will overall keep you out of the hospital and keep you from dying. That is the most important thing. Without a vaccine, with these variants, not getting vaccinated is an extremely risky decision. And so I would say get a vaccine, whatever vaccine you can, wherever you can.
Okay, thank you, Dr. Graves. Can you, once again, and I think what we're going to do is just focus questions to you first in English, and then we'll go over to Dr. Rodriguez. So can you talk about the difference in staffing between this July and last summer, and how many staffers have left? How many open positions do we have?
So I can tell you the data that is publicly available that I looked at this morning. So the University of Utah has over 700 open positions, and Intermountain has over 1,000 open positions. I cannot tell you off the top of my head what exact numbers there were last year, but what I can tell you is the University of Utah opened 20 additional ICU beds on May 29th, which required us to be able to staff 20 available ICU beds. We had nurses working extra shifts and providers working extra shifts. We don't have the nurses to be able to work extra shifts. The other thing to think about, well, two more, we don't have respiratory therapists, we don't have environmental services. So healthcare is also impacted by the number of people that have left the workforce. And we've seen this in all service industries. The other thing to keep in mind, though, is that when COVID-19 is running through our community, healthcare workers are impacted and they get sick too. So many people are parents, many people have to care for others. And so the more COVID in the community, the more sick calls we have, as do any place that has people working in service. And so what I have heard is we have hundreds of open positions that we did not have at this time last year. the COVID pandemic has been very, very hard for healthcare workers. We've seen a lot of suffering. The suffering we're seeing these days is preventable. And so what we need is our community to support us like they did last summer and keep this manageable, because we do not have a deep bench of people like we did before.
Okay, thanks, Dr. Graves. And what do you think could be the worst case scenario when you hear the number today over 800?
Yeah.
What goes through your mind in terms of the worst case scenario, and then what would be the best?
Yeah. So I think the best case scenario is that this is our peak, is that 800 cases a day is as high as we get, and then it trends down and we go back to feeling like life is closer to normal and this is over. That is the best case scenario. Best case scenario, we're 7 days away from that at minimum, and maximum probably 2 weeks, just knowing about transmission and positive rates over time. Worst case scenario is we continue in this pattern or more for 4, 6, 8, 12 more weeks. I want to remind everybody of what this looked like in 2020. So as a reminder, Memorial Day hit in 2020. We had an increase in cases. Schools went back in session late August. Our cases came up and we had a giant surge in November, December, and January with upwards of 4,000 cases per day on certain days. That is worst case scenario. I want to believe that we're not going to get there, because half of our patients or half of our population is vaccinated now. Half isn't, and many of us are living like there's not a virus out there. And so my personal fear is that this is going to get a lot worse before it gets better, in a situation where we cannot extend our care like we did before. And so we did not delay or postpone surgical cases during the first or the middle peak, November to January, except for a handful of days. So we are in a very different place now, where our ability to stretch and extend care for people is less than it was in the past.
Okay, thanks, Dr. Graves. Is there a threshold that would signal a need to make masks and other restrictions mandatory again? That might be a better question for the governor, but I don't know if you have any thoughts that you want to share.
Yeah, I think that is a better question for the governor. I will tell you that I do worry about our community with schools going back in session. I think that we saw what happened in 2020. I think that entering schools without mask mandate is concerning, but I can't answer what that threshold would be for someone else.
Okay. And is there any research behind fully vaccinated individuals contracting COVID-19 or their risks of getting long COVID? So I wonder if you could maybe flesh that out a little bit, Dr. Graves, and talk about the people we're seeing who are getting COVID-19 who are vaccinated. Can you maybe characterize that a little bit? And do we know at this point if vaccinated people are getting long COVID?
Yeah, great question. So I think the question is, let's talk a little bit about the patients we are seeing that are fully vaccinated, and do we know if they are getting long COVID? I think that's the question. Does that sound right?
Yeah,
Okay.
that's correct. That, and you know, what are we seeing in our hospital in terms of vaccinated patients?
Yeah, so the vast majority as a state, as in 95 to 99% of our patients that are, let me say that differently. The majority of people being admitted are unvaccinated. The majority of our deaths are unvaccinated. Our average age right now, I actually looked at this before I got on the call, is 50. Which is younger than what we saw before. And so that's reflective of the population that is less vaccinated, right? We don't have as many people that are 80 and up as we did a year ago. We have a lot of young people. So the 2 people sitting in the emergency department right now are both under 30. And so yes, we have younger people. The vast majority of them are unvaccinated. I have seen 2 fully vaccinated patients in our hospital. One of them has immunosuppression due to a transplant, and the other is very chronically ill. But what I want to make clear is vaccinated individuals getting clinically very ill is the vast majority or vast minority. Most of our patients that are very, very sick are unvaccinated. So not being vaccinated right now is a huge risk for serious illness and admission.
Okay, thanks. And then a question about support. So last summer, you know, there was more of this sense of we're all in this together, a lot of support for our healthcare workers. Do you feel like that's changed? Have people moved on?
It's hard. I think that there are people in the community who absolutely support us. I think there are people in the community who have gotten vaccinated. I think there are people in the community who recognize that this continues to be an issue and continues to be stressful for us. I do think that the majority of people, including healthcare workers, are tired of this. We are tired of living in a pandemic. We are tired of not living normally. And I think that's true for most people. And I want life to get back to normal as much as everybody else does. But we in healthcare have a responsibility to take care of people, whether or not there's a pandemic. And so I think my message is, yes, we all want this to end. The more quickly we get vaccinated, the more quickly we prevent further transmission, the more quickly this will end. And so we do need community support. And I think going in public in large groups with not being vaccinated is a huge risk factor right now. And so I think public health measures, vaccine, reducing transmission is really, really important when we have a very stressed healthcare system.
Okay, and what do you think it's going to take? Despite the pleas of getting everyone vaccinated, the needle doesn't seem to be moving. So Sean Means is asking, what is it going to take to get this in check?
So if I were magic, right, I would just make this safe and available and easy for everyone, because I think what we need to see the most is less suffering, less illness, right? This is heartbreaking to watch. I do want to talk a little bit about a study that was published last week. And so basically it was the Kaiser Family Foundation surveyed Americans in January of 2021 and said, hey, do you plan on getting the COVID-19 vaccine or not? And a quarter of people said no, they did not. However, in the 6 months that have followed, so until now, a quarter of that quarter has gotten a vaccine. And so the things that persuaded the people that were hesitant to get vaccinated were the inability to do things that they could do if they were vaccinated. So travel, go to concerts, things like that. Knowing that they could protect other people. And so keeping their family members safe, people around them that were sick, keeping them safe. And then seeing millions of vaccines being given safely. The adverse effects from these are very, very, very rare. And then the last thing is having conversations with people that they trust and respect. And so family, friends, healthcare workers making the recommendation that they get vaccines. And so I think there are people holding out for the full approval, which hopefully will be coming soon. I think there are people that are very hesitant to get vaccinated for one reason or the other. My one ask is to think about the risk of you getting COVID-19 and getting critically ill. There was an article in the Deseret News about a nurse practitioner who did not get the vaccine, was critically ill and admitted and expressed regret for not having done that earlier. So what's it going to take? I think it's a lot of us just saying we need to take care of each other. This is very, very safe. And then please talk with your healthcare provider if you have questions about getting the vaccine.
Okay, thanks, Dr. Graves. And Dr. Rodriguez, I'm going to flip over to you for a couple of minutes. You're wanting to make a couple comments on some of the questions that Dr. Graves has commented on. So let's have you.
Okay, so, oh, I'm supposed to be speaking Spanish, sorry. El asunto es la doctora Grace ha hablado mucho de las cosas que están sucediendo en cuanto a COVID-19 y realmente es un problema asombrante y un problema que nos tiene todos preocupados. Después de todo, no tenemos los recursos que teníamos el año pasado. Y no solo estamos hablando de la ausencia de mascarillas, estamos hablando también del hecho de que hay demasiadas personas que han salido del trabajo a hacer otras cosas. Y eso es en todos los sistemas de salud del estado de Utah y en el país. Entonces, lo que podíamos hacer el año pasado, convertir camas y preparar más camas para cuidados intensivos, tenemos las camas, pero no tenemos el personal. Porque hay más que 700 posiciones abiertas en el sistema de salud de University of Utah Health y más que 1000 posiciones abiertas en el sistema de salud Intermountain Healthcare. Así que los recursos están mucho peores este año que el año pasado. Además, debemos de recordar que este problema sigue subiendo. Y si hay un cambio El cambio es que no sube más, pero si no sube más, igual coge 2 semanas para volver a un nivel manejable. Y el problema que estamos viendo es que si la tasa de infecciones sigue subiendo, vamos a tener que ver un futuro que realmente se parece al pasado. Vamos a tener que hablar de mascarillas otra vez, de lavarnos las manos otra vez, de mantener una distancia de 6 pies. También hay una pregunta aquí de Rudy Nieves. Dice, ¿qué nos puede decir de los rumores, teorías conspirativas que se han hecho famosas en nuestra comunidad hispana? Algunos hablan de un chip, otros de rastreos. ¿Debe creer la comunidad en esos rumores? Gracias por la pregunta. Después de todo, debemos de recordar que como población latina, a veces somos el objetivo de campañas de mala información. Y hemos visto esto en otras situaciones y estamos viéndolo ahora. Pero todas las cosas que se mencionan en su pregunta son falsas. No hay ningún chip. No va a causar los problemas que están diciendo las personas. Y debemos de recordar que no millones, sino cientos de millones de personas en este país han recibido la vacuna y no han tenido ningún problema. Y la otra cosa que dijo la doctora Graves que quiero enfatizar es y es que la mejor vacuna es la vacuna que se puede recibir hoy. Así que meternos en problemas diciendo que una vacuna es mejor que otra realmente no vale en esta situación. Lo que vale es recibir la vacuna. Y si todos nosotros como pueblo tomamos la decisión de ir a la farmacia más cercana y pedir la vacuna, podemos cambiar los números empezando el día de hoy. Se ha dicho que el variante Delta es más infeccioso que los otros variantes. Y le voy a decir que eso sí es cierto, pero la mayoría de las personas que están en el hospital y la mayoría de las personas que se han muerto son personas que no han recibido ninguna vacuna. Así que cualquiera de las vacunas va a proveer protección si se usa correctamente y si se recibe pronto.
Thank you, Dr. Rodriguez. And I want to point out, I typoed a couple times on Dr. Rodriguez's title. It's the final one that is correct. So sorry about that. And Dr. Graves, I know you need to get going, so I'm going to give you a couple more rapid fire questions. So Jacob, we have a question from you asking if we support private businesses not to allow unvaccinated customers. That's a little bit more of a policy issue, and it's not really our role to comment on policy, but Dr. Graves, do you have anything on that you'd want to add?
Yeah, I think the only thing I will say about that is that the pandemic has been really, really hard for everyone. And I personally think that we should not be shaming anyone who's wearing a mask in public. And I don't think that judging people that haven't gotten vaccinated is the right thing either. I think, in my opinion, just doing what it takes to take care of each other to keep everyone safe is the right thing to do. But I think local businesses that are private can make the decisions they're going to make.
Okay, thanks. And then I have a question here about how has treatment changed for hospitalized people last year compared to what we're seeing right now, or have treatments evolved at all? And are people sicker now than they were last year? Are we seeing sicker people with the Delta variant, for example?
Yeah, so there is some data from, not thinking the country, I want to say the UK and Ireland, but I might be wrong on that because it's not in front of me, but basically that the Delta variant is twice as likely to result in hospitalization. I don't think we have enough data to say that here in Utah yet, only that what Erin showed is true, and that is that our hospitalizations are higher now than they were at a similar time last year. So I think we can say that. Now, treatments, there are a few things. So the biggest thing we have this year that we didn't have last year was a vaccine that's really safe and effective. We do have antibody therapies or Regeneron that we can give to people before they're hospitalized. So that is helping, and that probably does help avoid some hospitalizations. Very costly. It's not easily available, but it is out there. Otherwise, what we have done is the same thing we were doing before, and that is giving people steroids, giving them remdesivir if they're critically ill, proning them, doing all of the things that we were doing a year ago. So I think the biggest difference to me now is that this is largely preventable. That is the biggest difference, is that this is not suffering that needs to be happening. And that is really, really hard for families to see, for healthcare workers to see, when illness can be prevented the majority of the time.
Okay, thanks, Dr. Graves. And then of the people we're seeing, any different populations of people, or is it pretty much the same?
I think it's younger. I mean, how much younger, it would be hard for me to say without looking granularly at our data from 2020. But from my memory, I saw a lot more 70, 80-year-olds, a lot more really chronically ill people than we're seeing right now. So I saw a rare young person last year, but what's in the hospital now is the majority of people that are in the 40 to 65-year-old age group. We have a handful that are older than that and a handful that are younger, but it's younger people, and I feel pretty confident that that's the case.
And again, very quickly, what percentage of people that were vaccinated are getting COVID after vaccination? It's roughly 5%, if I'm not mistaken, correct?
Yeah, off the top of my head, it's in one of Erin's charts. And so, yes, we expect some breakthrough cases. There will be more of those when there's more COVID in our community. The biggest effect of the vaccine, though, is it prevents serious illness, hospitalization, and death, which is huge. And it does limit how symptomatic someone can get. So we do see breakthrough cases. It's the minority, and it's about 5%, yes.
And then of those 5%, we're only getting a very small percent of those hospitalized. It's
True.
like less than 2%, if I'm not mistaken, correct?
Right. So the numbers are, I think it's 98% off the top of my head. Again, so it's 95% or higher of people that are, let me say that differently. So the majority of people hospitalized are unvaccinated, like 95% plus.
Okay. And speaking of Erin's charts, Erin, we got a question. Can we share your charts? Are you comfortable sharing those? Can we send those out to the group with us today? Oh, you're on mute, but I saw you shaking your head. Yes. So, okay. Okay. And then wrapping up here, and then I think we have a couple more questions for Dr. Rodriguez, but another question here about people are, some people have commented 600,000 deaths is not that big a deal, but a couple minor, a handful of adverse reactions or breakthrough cases is grounds for condemnation of the vaccines. Like, do you have any comments on that? Like, maybe help put that in context a little more.
Yeah, I think it is hard for me to say specifically what someone else believes. What I will say, 600,000 deaths due to COVID-19 is tremendous. The average age of death in the United States got lower last year due to the COVID-19 pandemic. So there were enough people that died that it changed our entire society's demographics. There are kids without parents, there are kids without grandparents, there are people without loved ones. And so 600,000 is not negligible. I think there are a lot of things people think about when they think about COVID, and that is, oh, the majority of us are going to be fine, which maybe is true, but you never know when it's going to be you. And the person that thinks that may be the one that's critically ill. I do think that the longer the pandemic goes on, the more powerful the variants get, the higher the risk of getting COVID and getting very, very sick gets. So we are in a different world than we were last year. And so I think the serious side effects are minuscule compared to lives saved here. And so even in young age groups, the serious side effects are minuscule compared to the lives saved. Long COVID is real. I think it would be tragic to have somebody spend their entire life with lasting side effects from COVID-19. So we know that the vaccines are safe. We know they prevent long COVID. We know they help with long COVID. We know they prevent hospitalizations and deaths. And so I think that the best thing someone can do is get a vaccine to prevent this.
Okay. And then more questions on Facebook just about breakthrough cases. I think we answered that. Not seeing any other questions. Dr. Rodriguez, some final thoughts from you?
Yes. Entonces, la doctora Graves habló acerca de lo que son las herramientas que tenemos ahora en contra de la pandemia. Tenemos algunas medicinas que podemos dar en el hospital. Ninguna de las medicinas son medicinas para curar. Realmente son para proveer un poquito de alivio durante la enfermedad. Pero tenemos algo para prevenir y son las vacunas. Y como hemos dicho desde el primer día de esta pandemia, es que la prevención es la solución. Cuando no teníamos vacunas, le decíamos que teníamos que aislarnos, cubrir la boca, cubrir la nariz, lavar las manos, mantener distancia física, ver las doctoras cuando necesitamos. Y esas medidas de prevención hicieron que no se subiera tanto los casos cuando no teníamos vacunas. Y la prevención que tenemos ahora es la vacuna. La invitación es realizar que aunque 600,000 personas son un porcentaje muy bajo de la población entera de este país, igual son 600,000 personas que no pueden ver más a sus hijos, nietos, vecinos, amigos, hermanos. Y es una tragedia grandísima. Y es casi 100% prevenible con la vacuna. Así que la invitación es, si no se quiere vacunar porque no va a ser un problema para usted, piense en los demás. Debemos de recordar que es el amor que va a terminar esta pandemia y es el amor que tenemos hacia nuestros vecinos, amigos, familiares que nos puede motivar a tomar la vacuna y hacer que el virus no tenga donde vivir en nuestro estado y en nuestro país.
Thank you, Dr. Rodriguez. Erin, I'm going to put you on the spot for our final thought. Based on your projections, are you concerned about where we're going here in the next few weeks?
Yeah, thanks, Kathy. I think the thing that concerns me is our positivity rate is higher than the same time last year. Our hospitalizations are higher than the same time last year. And if you think back to the same time last year, collectively as a community, most of us, if not all of us, were masking. We were socially distancing. We were working from home. We were limiting our trips to the store. We were all taking those like basic public measures really seriously. Fast forward a year with positivity rates higher, hospitalizations higher, it looks like things are normal when you go outside. And although half of our population is vaccinated, we haven't even discussed the fact that 100% of the people under 12-year-olds aren't even eligible to get the vaccine. And the other half of the population isn't vaccinated. And we're dealing with a more transmissible variant right now. I am concerned for what's coming this fall when schools open. If we follow trends from last year, what happened when schools open, we're going to see an explosion of cases. So my ultimate takeaway is listen to the doctors on this call that say, please get your vaccination, talk to your healthcare providers, because we are setting ourselves up for a really difficult fall and winter.